Hi, I just want to show you my sheet before I begin. Hi. How are you doing today?
Good, how are you?
I'm good, thank you. My name is Erin. I'll be your student nurse today. Can you tell me your name and your date of birth?
Natalie Bargardi, 12/20/01.
Okay, great. And then do you have any allergies?
To amoxicillin.
Amoxicillin. Okay. Can you tell me who the current president is?
Joe Biden.
Excellent. And then what city are we in today?
Saginaw.
Great. Okay, so you are alert and oriented times 3, which is great. So now I'll continue. I'm going to ask you some questions about your health history, and then I'll do some vitals, and then we'll get into the physical assessment.
Okay.
So, have you had any past surgeries?
I've had one on my ear probably when I was 3 or 4, and that was for some like precancerous cells they were just taking out just to be safe.
Okay, and you haven't had any issues with that since?
Nope.
Okay, great. Are you on any medications at all?
Just like a multivitamin.
Multivitamin? Okay. Any herbal supplements?
Mm-hmm.
No? Okay, great. Do you have any family history of anything?
Not that I'm aware of.
No? Okay. Any personal history?
Nope.
Okay, great. Can you tell me a little bit about your diet?
I would say I eat about 2 to 3 meals a day. If I only have 2 meals, I usually have a couple snacks in between, and I try to eat some fruit and veggies, more so fruits than veggies, and I try to have at least some meat every single day just to try to keep my protein intake up.
Yeah, that's good. That's a good balance.
Mm-hmm.
Do you have any history of smoking?
No.
Any drinking?
Mm-mm.
Okay, and then do you do any other recreational drugs at all?
No.
Okay, wonderful. How much would you say that you exercise per week?
I would say I exercise. I walk to class every single day,
Mhm.
and then sometimes I go to the gym once or twice a week, and I play basketball with friends.
Okay, great. That all sounds really good. Okay, so that's it for my questions that I have for you.
Okay.
So now I'm going to go ahead and take some of your vitals.
Sounds
So
good.
I will start with your pulse.
Okay.
Okay, great. So your pulse was 68, so that's good. That's within the normal range. We're looking
Okay.
for 60 to 100. And then your respirations were 20, and
Okay.
that's also in the normal range. That's going to be 12 to 20. So
Okay.
excellent. Okay, so now I'm going to go ahead and take your blood pressure. Do you have a preference on which arm we do?
My right is fine.
Great. Does that feel good?
Yep.
Okay. Okay, so I got a blood pressure of 110/72. Is that normal for you?
Yeah.
Okay, wonderful. So that's good. That's also in the normal range. So
Okay.
That's good. Okay, so at this time, I would also take your temperature, which we would want it to be around 98.6, and I would also take your pulse ox, and that would be around 97 to 100%.
Okay.
But we do not have those tools today to do that. So now I'm going to move on to the physical assessment. So I'm going to start with your hands. So I like your rings. These are pretty.
Thank you. I wear a lot of them.
Yeah. Do you have any problems with your skin on your hands?
No.
Okay, that looks good to me. I'm going to check your capillary refill. Good, it's less than 3 seconds, so that's good. That means that there's good blood flow to your fingers. And I don't see any clubbing, so that's also good. Okay, so now I'm going to check the skin on your arms as well. It looks pretty good. Have you had any issues with your arms? Okay, great. Good. Okay, so now I'm going to do a couple of strength tests.
Okay.
So can you go ahead and grip my hands for me? Excellent, nice and strong and symmetrical. And then I'll feel your muscle tone. Feels good and symmetrical there. Can you do some arm pumps for me? Excellent, and then can you do this motion? Great, and then can you go ahead and push up on my hands? Good, and then can you push down? And then I'll have you push out. Good, and then I'll have you push in. Good, okay, nice and strong. And everything felt the same on both sides, so that's really good.
Okay.
So now I also want to test your cerebellar function
Okay.
here with your arms. So can you go ahead and make an okay sign for me, and then switch fingers, and then do it really fast. Excellent. And then we'll go ahead and put your hands on your knees and flip them, and then do this really fast. Great. And then I'm going to have you touch your nose to my pen light, and then back to your nose as I move it around. We'll do that a couple of times.
Okay.
Good. Very good. And down here. Excellent. Perfect. Okay, so you have good cerebellar function. So I also want to test your cranial nerve 11,
Okay.
which is your spinal accessory. So can you go ahead and shrug your shoulders for me? Great, excellent. And then I also want to check your shoulders for any crepitus.
Okay.
So that's just some bone-on-bone contact that I'm looking for. So I'm gonna go ahead and hold your shoulders like this. Can you do a swimming motion for me? Good. Okay, and then can you do it backwards also? Good. Great. Okay, I actually did not hear any crepitus, so that is excellent. Okay, so while I'm here, I also am gonna do your patellar reflex.
Okay.
In some range of motion with your legs. So we'll start with the patellar reflex. Okay, so I saw that one move. And I saw that one move. Excellent. Okay, so now I'm gonna just range of motion. First, I want to feel your muscle tone on your legs. Feels nice and even, and I don't see any edema in your legs, so that's good. Your skin looks good. I don't see any problems. Have you had any issues with skin on your legs? No? Okay, great. So I'm going to have you push in with your knees. Good. And then push out with your knees. Good. And then push up on my hands. Excellent. And then I also, the same thing for the shoulders, I want to check for some crepitus in your knees. So go ahead and move your legs up. Good. Good. Okay, so I felt a little crepitus in this one, but that's okay, not too much.
Yeah, I hurt this knee in soccer.
Oh, you did?
Mm-hmm.
Okay. Have you had any problems with it? Recently?
It's a little painful sometimes when I'm working out.
Okay.
Usually I just ice it and it goes away.
Okay, that's good. That's good. Okay, so Okay, so I'm gonna come back to your legs later. So for now, I'm gonna move on to your head.
Okay.
So we can go ahead and put the blanket back on.
It's chilly in
It
here.
is quite chilly in here. Okay, so can you take your hair down for me, please?
Yeah.
I want to check your scalp, make sure everything looks good there. Looks good. Do you have any pain? Okay, good. Okay, so I don't see any lesions. I don't see any lice or anything else in your scalp. It looks good, nice and healthy. Do you dye your hair?
I've had highlights before, but it's been about a year since I got them.
Okay, so you don't have any issues with that?
Mm-mm.
Okay, great. And then I want to do a strand test. Okay, good. So no hair came out, so that's great. You can go ahead and put your hair back up if you'd like. So I'm going to move on to your face. I'm going to look at your skin. Your skin looks good. I see there's some irritated spots. Do you have any issues with your skin on your face?
Just acne.
Okay. All right, so now I'm gonna move on to your eyes. So I'm gonna look at your eyebrows. They look good, even. Your eyelashes look good. Your eyelids also look good. So I'm gonna pull down your eyes really fast and look at your conjunctiva, nice and pink. And your sclera, which is the white part on your eyes, looks really healthy and white. So that is excellent. Okay, so now I'm gonna do a few tests on your eyes. So I'm gonna test your pupils really fast and make sure they're dilating and constricting appropriately, okay?
Okay.
So just go ahead and look at me, and I'm gonna just shine this light in your eyes really fast. I'll try not to do it for too long. Okay, great. Okay, great. So that was good. Your eyes both dilated when the light hit them. So now I want to test your eye movement. So this is going to test cranial nerves 3, 4, and 6. So I'm going to be moving my pen light around, and I want you to just follow it with your eyes, okay?
Okay.
So this is called the 6 cardinal gaze of view. And it tests all kinds of eye movements. Great, okay. So your eyes were able to follow that pen light really good. Oh, I still need my pen light. So now I want to test your accommodation. So I'm going to have you look at my pen light and then look at this wall behind me. So go ahead and look at the pen light and then look at the wall behind and then back to the pen light and the wall behind. Great, okay. So I would say that your pupils are perla, which means that they're equal, round, reactive to light, and accommodating. So that's excellent. And your eye movements looked great. Okay. So do you have any problems with your vision, or do you wear any glasses?
No, I don't.
Okay, that's good. So if I had a Snellen chart, I would also test your vision. That would be testing your cranial nerve 2, but I do not have that today,
Okay.
so we won't be doing that. So now I want to move on to your nose.
Okay.
So have you had any runny nose, any drainage lately?
Sometimes I get bloody noses, but I haven't had one probably in a couple weeks.
Okay, that's good. Is that normal for you to get bloody noses?
Yeah, if my nose gets too dry, my room's a little drafty, so
Yeah.
sometimes that happens.
Okay, that's good. Okay, so I'm gonna go ahead and shine my light up your nose. I want to just look inside, see everything is looking good. There's no drainage that I see, and it does not look like you have a deviated septum. So that's good. So now I want to test your smell. So that would be cranial nerve 1.
Okay.
So I'm going to have you close your eyes, and then I'm going to go get something for you to smell, and then I want you to tell me what it smells like.
Okay.
Okay, whenever you're ready.
I smell mint.
That is correct. It was mint gum. Excellent. Okay, so now I'm going to move on to your mouth. So your lips look good, nice and pink. So I want to look inside your mouth as well. So go ahead and open wide. Good. Okay, so I'm looking at your gums. They're nice and pink. And I'm looking at your teeth. Very straight. And your soft and hard palate look good. Do you have any issues with your gums, your teeth, anything like that? Have you had braces?
Yeah.
Okay. And you don't have, that went well for you? And okay, great. So I also, while I'm here, looking at your mouth, I want to test cranial nerves 9, 10, and 12.
Okay.
So that just makes sure that little thing in the back of your throat rises when it's supposed to, and then I also want to make sure your tongue movements are good.
Okay.
So I'm gonna go ahead and have you open up and say ah. So do you have a strong gag reflex?
I do.
Okay, so I'll make sure I don't go too far for you.
Yeah.
So let's say ah.
Uh,
Okay, great. So your uvula did rise, so that's good, that's what we want to see. And then can you stick your tongue out for me and move it side to side? Excellent. Okay, perfect. So now I want to test your cranial nerve 7. So I'm going to have you make some funny faces.
Okay.
So can you smile big for me? Perfect. Can you make an angry face? Excellent. And then can you puff your cheeks? Good. And then can you make a frowny face? Perfect. Okay. So that was good. Now the last thing I want to check is your cranial nerve 5. So go ahead and clench your jaw for me. Good. So this is the muscle, the cranial nerve that's responsible for chewing. So that feels nice and strong. That's good. And then I also want to test the sensation on your face.
Okay.
So I'm going to go get one of my tools. It's not sharp, but I'm going to press different areas on your face when your eyes are closed, and I want you to tell me where I'm touching.
Okay, sounds good. Left cheek,
Good.
forehead, chin, right cheek, nose.
Perfect. Okay, that was great. So I also want to check your ears.
Okay.
So I'm gonna just take a look in your ears. If I had an otoscope, which I don't today, I would pull your ears up and back like this so I could look in your ear canal, and then I would be looking to see your eardrum, and I would want to see a shiny, pearly gray color.
Okay.
So, but for now, I'm just gonna look and make sure there's no drainage or any lesions or anything I should be worried about. Okay, so that looks good. I also just want to make sure that your earlobe, which is called your pinna, I'm gonna compare them and make sure I don't feel anything. I see you have a lot of earrings.
And I do.
Have you had any issues with any of your ear piercings?
No.
Okay, good. Excellent. Well, they feel equal, so that's good. There's also cranial nerve 8 that I did not test. That's with your hearing and your balance. But we're going to do that later in the assessment when I test your balance when you're standing up. So
Okay.
we'll get to that later. Okay. So while I'm by your head, I also want to check your sinuses and your lymph nodes. So
Okay.
we'll start with your sinuses.
Okay.
So just let me know if you feel any pain or tenderness. So this is your frontal sinus, and then you have one here. This is your maxillary. Any pain or tenderness?
No.
Okay, great. So now I'm gonna do your lymph nodes. You have a lot of them.
Mm-hmm.
So this is your occipital. So they feel good and symmetrical. And then this is your post-auricular. And then your pre-auricular. And then your submental. Submandibular. Feels good. You have your cervical chain. And then there's one under your clavicle. It's called your supraclavicular. So you could just shrug up like this. Perfect. Feel for those, and those feel good. Okay, so I did not feel any swelling. They all felt symmetrical. And while I'm near your clavicle, I want to check your hydration status. So I'm just going to pull up some skin. And good. It snapped back really fast, so I did not see any tenting. That's when the skin stays up if you pull it. And so it looks like you're very hydrated today, so that's very good.
Okay.
Okay, so I'm going to check your tracheal alignment as well and make sure it's in the middle, which it is. Do you have any problems swallowing or anything?
No.
Okay, great. So I also want to check your carotid arteries. Those are the big arteries in your neck. So I'm going to feel for them and make sure they feel symmetrical, but I'm only going to do them one at a time. And then I'm going to listen for a bruit, which is like a whooshing sound. that would indicate some blockage in your artery, and I don't want to hear that, so I don't expect to hear it, but I still want to listen just to make sure.
Okay.
So I'm going to go ahead and palpate them. So that's nice and strong. And that's nice and strong as well. And they felt the same, so that's
Okay.
good. So now I'm going to go ahead and listen with my bell. Again, only one at a time. Go ahead and hold your breath for me. Okay, great. You can take a breath out. And again. Okay, great. So I did not hear anything, so that is excellent. Okay, so now for the next part of the assessment, I'm gonna go and I'm gonna stand behind you.
Okay.
But before we do that, I'm just gonna go take a look at my sheet and then we'll move on.
Okay.
Okay, so before we move on, I just want to check your arteries really fast. There's just 2 in your arms that I have not looked at.
Oh,
So I just want to make sure that they're symmetrical, and then we can move on.
Okay.
So I'm going to check, I'll move this up, I'm going to check these. These are your radial pulses, and they're good and symmetrical, nice and strong, and then these are your brachial pulses. And those also feel strong and symmetrical.
Okay.
That is great. So now I'm going to move the camera so that they can see the back.
Okay.
And then we'll do the next part of the assessment. Okay.
Am I okay here?
Yep, that is great. Okay. Okay, so I'm gonna look at the skin on your neck first. It looks good. And then I also want to feel for your thyroid. So your thyroid kind of sits right behind your trachea, which is the windpipe where you get your air traveling to your lungs.
Mm-hmm.
So I'm gonna go ahead and move it a little bit to the side. It might be a little uncomfortable, but I'll try to be quick.
Okay.
So I'm gonna move it to one side and feel, and then move it to the other side and feel.
Okay.
So, okay, good. Okay, great. Good. So that felt good. I didn't feel any abnormal swelling or anything. So now I want to assess your lungs.
Okay.
So are you okay if I untie this top
Yeah,
one?
that's fine.
Okay, perfect. I'll try to keep you as covered as I can. So I'm going to be percussing, which is kind of like drumming on your back. It's a little funny, but it helps me listen to the sound of your lungs.
Okay.
And so I'm going to be doing that in 12 different spots on your back. So like 6 spots for each lung, and then after I'm going to listen with my stethoscope. Okay?
Sounds good.
So I'm going to start off. Well, first, before I begin, I want to check your chest wall expansion.
Oh, okay.
So I'm going to come down here. Move your shoes for a second. I'm going to come down here, and I want to make sure I'm getting all of your lungs when I'm listening and percussing. So go ahead and take a deep breath. Excellent. Okay, so your chest wall expansion was symmetrical. My hands moved at the same time in the same way, so that's good.
Okay.
So I'm going to go ahead and percuss the first spot, and the second spot, and the third, and the fourth, and the fifth, sixth, seventh, eighth, and the ninth. I'm just going to come under here really quick. 10th, and the 11th, and the 12th. Okay, great. So that's good. I heard resonance, which is what we want to hear in your lungs. So now I'm going to go ahead and take a listen with my stethoscope.
Okay.
So again, I'm going to be doing the 12 spots. Each time I move my stethoscope, I'm going to have you take a deep breath in and deep breath out.
Okay.
So I know that can be a little exhausting. Just let me know if you need a break, okay?
Okay, sounds good.
Okay, so here's the first one. Go ahead, take a deep breath in. Good. And the second one, go ahead. And the third one. And the fourth. And the fifth. The sixth. And the seventh. And the eighth. Good. And the ninth. 10th, 11th, and last one, the 12th. Excellent. Okay, so your lungs sounded clear and symmetrical, so that's really good. And while I'm back here, I also want to check the skin on your back and make sure that it looks good. It doesn't look like you have any irritation. I see you have a tattoo here.
Yes.
Did you have any issues with that at all?
No, I didn't have any problems with it healing.
Okay, good. Good, your skin looks good. You don't have any issues with your skin, it seems. Okay, I do see you have a mole here, but it doesn't look concerning.
Okay.
Okay, so I'm going to tie this back up for you. Actually, we're gonna leave it undone because now I want to go and listen to your heart sounds.
Oh, okay.
So I'm gonna have to move it around a little bit.
Okay.
So we're gonna have you go ahead and lay down.
Okay.
So go ahead and make sure you're safe. And your bed is locked in and your rails are up, so I know that you're safe. I'm gonna go ahead and keep you as covered as we can. Okay. You comfortable?
Yes.
Okay, great. So I'm gonna have you hold the camera above so we can see that listening to the right heart tones.
Okay.
Okay. So with these, I'm going to be listening with both sides of my stethoscope.
Okay.
So the first side I'm just listening to your heart sounds like the lub-dub sound, and the second time I'm gonna be listening with the bell, and that's gonna be listening for a murmur, which we don't wanna hear, okay? So, and there's 5 spots.
Okay.
So the first one is going to be your aortic.
Okay.
And that is going to be on the right side, and that's the second intercostal space. So here's your clavicle, your first, and your second. So it's going to be right here. Good. Okay, I heard that lub-dub, so I'm going to keep my place. And then I'm going to listen with the bell for a murmur. Good. Okay. So now I'm going to move on to the second one. That's going to be your pulmonic heart sound. So that's going to be the second intercostal space as well, just on the left side. So 1, 2. Okay, good. I heard that nice lub-dub. I'll listen with my bell. Excellent. Okay, so now I'm going to go down to the third intercostal space, so that would be called Erb's point. So just go down one more. Good. That one was nice and loud. So now I'll listen with my bell. Excellent. And now we go down another to the fourth intercostal space. So it's gonna be right here. And this is your tricuspid. Okay, and now with the bell. Excellent. And then I'm gonna go ahead and move your gown up because the fifth one is kind of lower.
Okay.
So I'm gonna still keep you as covered as I can. Okay. So I'm gonna go ahead and recount since I lost my spot. 1, 2, 3, 4, and then 5. So I'm gonna come and meet it, and it's gonna be mid-clavicular, so it's gonna be about right here. There we go. Okay, that sounded good. I'm gonna listen with my bell. Okay, good. And then I wanna listen to this spot for a full minute with my diaphragm, and I'm gonna count your apical pulse. And this is your mitral.
Okay.
Okay, great. So with that one, I heard a pulse of 72.
Okay.
So that is great.
Mm-hmm.
And that was very similar to the one I heard earlier. So that's
okay, good.
So while we have you here laying down flat, I want to check your jugular veins for any fluid in them. That's called jugular vein distension.
Okay.
So go ahead and look to one side for me. Good. Okay, I don't see any. And go ahead and look to the other side. Okay, good. I don't see any. So that's great. So you don't have any fluid overload, it looks like. If you did, if I saw any, I would have you sit up 45 degrees and reassess just to make sure.
Okay.
So now I also want to just check your skin because I didn't do that before.
Okay.
So I'm going to go ahead and look at your skin. It looks like you have some irritation here.
Yep, just some acne.
Normal? Yeah, okay. Yep. Okay, and everything else looks good. Okay, so now we're going to move on to your abdomen. So I'm going to keep you covered up here.
Okay.
And move this down a little bit. Okay, so the first thing I want to do is assess and just inspect your abdomen without touching it first. So I'm gonna go ahead and I'm gonna come to the edge of the bed and look, and it looks nice and symmetrical. And I also want to come to the side and just look too. Okay, good. It looks symmetrical, and I do not see any abnormal bumps or anything. So now I want to listen and auscultate with my stethoscope.
Okay.
So I'm gonna listen in 4 places on your abdomen. I'm gonna start in the right lower quadrant and move this direction. And I wanna listen to about 5 gurgles in each quadrant, and that's just gonna be listening for your bowel sounds.
Okay.
Okay, good. I heard about 5 gurgles there. Good, I heard some there. Okay, great. Okay, good. So I heard about 5 gurgles in each quadrant, so that's good. And before I move on and do anything else with your abdomen, I also want to listen to your arteries. So there's 7 of them I'm gonna listen to, but
Okay.
I'm gonna only listen with my bell because I'm listening for those breweries that we talked about earlier. So I'm hoping to hear nothing.
Okay.
So I'm gonna start listening right here. This is going to be your aorta, your aortic artery. Okay, good. I don't hear anything. Then I want to go to your right renal. Okay, good. And your left renal. Good. And then I'm going to come down to your right iliac. And your left iliac. Good, I didn't hear anything. I also want to listen to your femoral arteries, so I'm going to feel them and listen to them. So they're kind of in your groin area on the sides of your legs.
Gotta readjust the camera.
So I'm going to feel for them first.
Okay.
Take my stethoscope off. So they're going to be about right here. Okay, good. Those feel strong and symmetrical, so that's good. So now I'm going to listen with my bell.
Okay.
Make sure I don't hear anything. Okay, great. I didn't hear anything there. And I did not hear anything there either. Okay, so that is excellent. I'll cover you back up. So now I want to go ahead and percuss your abdomen just like we did for the lungs. It's going to be that tapping. And I just want to listen for some sounds. And then I'm also going to listen for where your liver is also.
Okay.
So I'm going to start here again in the right lower quadrant. Okay, great. And then I also, I heard tympani in all of those places, which is good. That's what we want to hear over the bowels.
Okay.
And then I also want to listen to where your liver is. So I'm going to start from down here and kind of work my way up.
Okay.
Okay, there it is, right there. I hear it.
Okay.
So that's where your liver is supposed to be located. So that's good. It
Okay.
kind of sits right under your rib. So that's good, and it all sounded good, and everything was where it was supposed to be.
Okay.
So now I'm gonna do 2 types of palpation. So that's just when I kind of press on your stomach. So I'm gonna do light, and then I'm gonna do a little bit deeper.
Okay.
So just let me know if you have any pain or tenderness when I'm doing this, okay?
Okay.
So I'm gonna start here again. And I'm gonna go in all 4 quadrants. Any problems with that?
Nope.
Okay, great. So now I'm gonna go a little bit deeper. And this is just making sure I don't feel any masses or anything abnormal.
Mm-hmm.
Okay, so that all was good. So that completes your abdominal assessment. So now I'm gonna move on to your legs.
Okay.
I'm gonna cover you back up. We'll go down here. So we already did your femoral arteries, so now I wanna assess.
Do you want to take the camera from me? Thank you. And you can, if you want, set it back up.
Okay, I'll set it back up.
Okay.
I'm just gonna put it. Just kidding, I'm putting it over here.
That's probably the better angle.
Yeah. Okay. So Now I'm going to assess the arteries in your legs.
Okay.
So you have some under your knee. Those are called your popliteals. So I'm just gonna feel them at the same time. Okay, good. They feel symmetrical, so that's good. Those ones are hard to find sometimes.
Mm-hmm.
And then I want to feel your posterior tibialis. That's going to be inside of your ankle. Good. Those feel symmetrical as well.
Okay.
And then you also have some on the top of your feet. So do you mind if I slip your socks out?
That's fine.
Okay, great.
My feet are a little ticklish.
Okay, that's good. I'll be nice and quick. Okay, so these are your dorsalis pedis pulses. And those feel symmetrical as well, so that is good. And I did some of your legs before, so I was checking for edema. It still looks like you don't have edema, and your muscle tone is good. So before I sit you up, because we're gonna sit up and then we're gonna stand,
Okay.
I'm gonna have you do some more range of motion things and more strength things just to make sure you're safe to stand up. But I also want to test the sensation on your legs and your feet. So I'm gonna go get one of my tools. So just like we did on your face, I'm gonna have you close your eyes and identify where I'm touching, but this one's gonna be a little bit different because there's two different types. So this one is the dull side and this one is the sharp side.
Okay.
Can you tell the difference?
Yeah.
Okay, great. So I'm gonna do in 8 different spots.
Okay.
So I'm gonna move the blanket out from under your feet just to make sure, and then we're gonna make sure you're covered here before I start. Okay.
Dull right thigh,
Yep, great,
sharp left calf,
good,
sharp right calf, dull left thigh,
excellent,
dull right top of foot, sharp left top of foot,
good,
dull bottom of right foot,
good,
and dull bottom of left foot.
good. Was that ticklish?
Yeah.
Okay. Well, good, you have good sensation. You identified all of those correctly, so
Okay.
that's good. While I'm here and your socks are off, I also want to look for your capillary refill in your toes, just like I looked at your fingers.
Okay.
And then, good, it's less than 3 seconds, so that's good, good blood flow. And then
Okay.
I also am looking at your toenails and I don't see any clubbing here either. I'm gonna look at your skin. Oh, I see you have, is this a tattoo?
No, it's just pen.
It's just pen.
Yeah.
Okay. Okay, so your skin looks good and your legs looks good. Okay. So that is good. All right, so now we're gonna go ahead and have you sit back up.
Okay.
So go ahead and make sure you're good. We can retie your gown for you.
Oh, okay, thank you.
Of course. Oh, there we go.
I think I was sitting on it.
Okay, so go ahead and have your feet swing over like this. Good. Okay, so before I stand you up, I just want to make sure that your feet and your legs are strong enough. So I know we did those strength exercises before, but I did them with your legs and I did not do them with your feet.
Okay.
So can you go ahead and do some ankle circles like this with both of them? Oh, there's some cracking.
Yeah, that's
That's normal. Okay, great. And then I'm gonna go ahead and have you press up on my hands with your feet. Great, and down. Good, nice and strong. Go ahead and press out. Good, and then press my hands in. Excellent. Okay, so that was all good. So we're gonna put your socks and your shoes back on.
Okay.
And make sure I'm putting them on the right foot. Okay.
Thank you.
You're welcome. It's always important to have your shoes on. Ooh, my pen. Before you stand up for
Okay.
safety. So go ahead and we're gonna stand you up.
Okay.
And, okay, so this is the test that I was talking about earlier. That test is cranial nerve 8, so you're balanced. It's called the Romberg test.
Okay.
So I'm gonna stand here. I'll have my hands in front and behind you, ready to catch you if you fall, which I don't think you will. But you're gonna just close your eyes, and I'm gonna make sure that you don't sway, okay?
Okay.
Okay, good. So there was no swaying, so that's good. I would give you a negative Romberg test, which is what we want to see. So since you have that, I feel that it's safe to ambulate you or have you be able to walk. So we're gonna go ahead and we're gonna walk this direction towards the camera, just normal. And then on the way back, I'm gonna have you walk heel to toe, okay?
Okay.
So, and I'll again be right here if you need anything.
Okay.
Okay, great. And then heel to toe on the way back. Okay, wonderful. And you don't feel dizzy or anything?
Mm-mm.
Okay, good. So we can go ahead and have a seat. So that concludes the head to toe assessment. So I don't have any concerns for you. All your body systems look nice and healthy and they are working properly, so that's good. I also need to give you a Braden scale.
Okay.
So based on the assessment that I did, I looked at your skin, it looked good, it didn't look too moist, so that's good. You say that you exercise and you walk normally, so I'm not worried about any mobility issues. You're moving around just fine, walking just fine, so I'm not worried about that. We talked about your nutrition and you're getting good nutrition, so I'm not worried about that at all. So based on all of those things, I would give you a Braden scale of 23, which is the highest score, which is what we want.
Okay.
So I'm not worried about you getting any pressure ulcers.
Okay.
Do you have any more questions for me?
I don't think so.
Okay, so before I end the video, I'm going to look over my sheet one last time just to make sure I got everything,
Okay.
and then we'll be done.
Sounds good. Thank you.
Okay. So, if you don't have any more questions, then I think we're all done for today.
Awesome.
Thank you for being my patient.
Yeah, thank you.